Phenobarbital-induced hematologic changes in cats, a detailed examination. Introduction. Phenobarbital PBIHA is a first-line anti-epileptic drug AED frequently prescribed for cats experiencing recurrent epileptic seizures. It's recognized for its efficacy in controlling seizures and its relatively wide therapeutic index, meaning a safe range of dosage exists. While severe systemic side effects are uncommon, PB has been linked to hematologic abnormalities, PBIHA, in dogs, raising concerns about similar effects in cats. This study investigates the prevalence and clinical significance of PBIHA, particularly focusing on cytopenias, reductions in specific blood cell counts, in cats under PB treatment. Study design and methodology. This research employed a retrospective, single-center design, analyzing medical records of 69 cats diagnosed with suspected idiopathic epilepsy, a form of epilepsy with unknown causes, at the small animal clinic of the University of Veterinary Medicine in Vienna from 2006 to 2021. The study focused specifically on cats that had received PB treatment, either as monotherapy or in combination with other AEDs like levetiracetam-lev for at least 2 weeks and had undergone at least one hematologic examination after the 2-week mark. Inclusion and exclusion criteria. The study included cats with a history of recurrent seizures, no interval between seizures, neurological signs, and normal findings on clinical examinations and serum biochemistry tests. Further, cats with available brain MRI and cerebrospinal fluid CSF analysis were included only if their results were unremarkable. Cats diagnosed with structural brain diseases or neoplastic diseases known to cause hematologic abnormalities were excluded to ensure the focus remained on potential PB-induced changes. Hematologic analysis and grouping. Hematologic analysis involved measuring various blood cell counts, including hematocrit, the proportion of red blood cells in the blood, leukocytes, white blood cells, neutrophils, a type of white blood cell crucial for fighting bacterial infections, and thrombocytes, platelets involved in blood clotting. These measurements were taken before starting PB treatment baseline and then during treatment monitoring. Severity grading. The severity of any detected hematologic changes was graded according to the Veterinary Cooperative Oncology Group. Common terminology criteria for adverse events, COG-CTCAE, guidelines and the laboratory's established reference ranges, as detailed in Table 1. This classification system categorized changes as increased, within the normal range, mild, moderate, severe, or life-threatening. Statistical analysis. Data analysis was performed using Analyze It software, version 5.65, Leeds, UK. Non-parametric statistical tests, specifically the Wilcoxon-Mann-Whitney, Kruskal-Wallis, and Steele tests, were employed to compare quantitative variables between different groups based on treatment duration, PB serum levels, and monotherapy versus combination therapy. A p-value of less than 0.05 was considered statistically significant, indicating a strong likelihood that observed differences were not due to chance. Key findings: widespread prevalence of cytopenias, a striking 76.8% of the cats in the study. 53 out of 69 exhibited cytopenias, marked by a decrease in at least one blood cell type during their PB treatment. This high prevalence points to a significant impact of PB on the hematologic profile of cats. Neutropenia and leukopenia dominate. Among the various cytopenias observed, neutropenia, affecting 60% of the cats, and leukopenia, present in 49.3%, were the most prevalent. This finding emphasizes the potential of PB to suppress the production or survival of these crucial white blood cells. Thrombocytopenia and anemia less frequent. Thrombocytopenia, a decrease in platelet counts, was found in 24.1% of the cats for which thrombocyte data was available, and anemia, indicated by reduced hematocrit, was present in 20.3%. While less common than neutropenia and leukopenia, these findings still underscore the need for monitoring these parameters in cats receiving PB. Severity generally mild to moderate. Reassuringly, the majority of observed cytopenias were classified as mild or moderate in severity. This suggests that while PB frequently impacts blood cell counts, the effects are often not severe enough to cause immediate clinical concern. Rare cases of severe neutropenia. Only 2 cats in the study developed severe or life-threatening neutropenia. 1 cat exhibited severe leukopenia and neutropenia after 571 days of PB treatment, while the other developed moderate leukopenia due to severe neutropenia after 114 days. Importantly, despite the severity of these cytopenias, neither cat displayed clinical symptoms directly attributable to the low blood cell counts, anemia recovery and potential confounders. Of the cats that developed anemia, most saw their hematocrit levels return to the normal range during the course of their treatment. However, 5 cats experienced persistent anemia. In these cases, further investigation suggested potential underlying conditions, such as chronic kidney disease or anemia of inflammation, as contributing factors. This highlights the importance of considering other potential causes when evaluating anemia in cats on PB treatment. Combination therapy and lower hematocrits. The study revealed a significant finding. Cats receiving PB in combination with lev had statistically lower hematocrits compared to those on PB monotherapy. This suggests a potential additive or synergistic effect of the 2 drugs on red blood cell counts, warranting further investigation into the safety and monitoring of this combination therapy. Intriguing influence of PB serum levels. A particularly interesting observation was the lower leukocyte counts in cats with PB serum concentrations within the therapeutic range, 25-35 ml. compared to those with levels outside this range. Moreover, one of the cats with severe leukopenia had PB levels within the therapeutic range. This unexpected finding raises questions about the relationship between PB serum levels and leukopenia and suggests that monitoring blood cell counts might be necessary even when serum drug levels appear optimal. Treatment duration and Neutropenia. The study also noted a potential link between the duration of PB treatment and the severity of leukopenia and neutropenia. This observation, consistent with findings in other studies, suggests that the risk of developing more pronounced cytopenias might increase with prolonged exposure to PB. Discussion: higher prevalence in cats compared to dogs. The study's finding of a 76.8% prevalence of PBIHA in cats is notably higher than the 4 to 22% reported in previous studies on dogs. This discrepancy might reflect species-specific differences in PB metabolism or sensitivity to its effects on blood cell production and survival. Clinical significance remains a key question. Despite the high prevalence of PBIHA in cats, the lack of overt clinical symptoms directly linked to cytopenias in most cases is a reassuring observation. However, the study emphasizes the need for continued vigilance, particularly in cats with severe neutropenia, as they might be more susceptible to secondary infections. Potential mechanisms warrant further investigation. The precise mechanisms by which PB induces hematologic abnormalities remain unclear. The two primary hypotheses involve either direct damage to circulating blood cells, peripheral destruction or suppression of blood cell production within the bone marrow. The lack of bone marrow examinations in this study, due to the absence of clinically relevant symptoms, prevented definitive conclusions regarding the underlying mechanisms. Combination therapy requires careful consideration. The finding of lower hematocrits in cats receiving PB and LEV in combination highlights the potential for drug interactions and the need for careful monitoring of patients on this regimen. Further research is necessary to fully understand the combined effects of these drugs and to establish guidelines for their safe and effective use. Limitations of the study. As with any retrospective study, limitations exist. The primary limitation is the inability to definitively establish a cause and effect relationship between PB and the observed cytopenias. Ideally, a controlled study involving treatment discontinuation and re-challenge would be necessary to confirm causality. However, such an approach is ethically problematic and clinically impractical in cases where PB is effectively managing epileptic seizures. Conclusion: this study provides valuable insights into the prevalence and clinical implications of PBIHA in cats. While cytopenias are common in cats on PB therapy, they are often mild to moderate and typically do not result in clinically significant illness. However, routine monitoring of hematologic parameters, especially neutrophil counts, is strongly recommended for all cats receiving PB. Further research, particularly prospective studies incorporating bone marrow evaluations, is essential to elucidate the underlying mechanisms, long-term consequences, and optimal management of PBIHA in cats. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.